COVID-19 infections, hospitalizations, and deaths continue to drop here in the U.S. That's some good news. But top health officials say vaccination and boosting will be critical to keep that momentum going.
Yeah, we're talking about a fourth dose here of that COVID-19 vaccine that might be recommended this fall. Here's Mandy Gaither.
In the war on COVID-19, the U.S. is heading in the right direction. The new daily case count down 42% since last week. The FDA is continually monitoring data to determine if or when healthy adults could benefit from a fourth COVID-19 shot.
Many of us expect that in the years to come, we will have yearly doses of COVID vaccine, the same way that we do for the flu vaccine.
Countries like Israel and Sweden are already offering a fourth shot of COVID-19 vaccine for older adults. In the U.S., an FDA official says a fourth dose could happen this fall. Right now, the CDC has no recommendations on fourth doses for the general public, but their updated guidelines seem to suggest it's a good idea for some who have weakened immune systems to get a fourth shot of the Moderna or Pfizer vaccine.
People who are immunosuppressed should be going and getting a fourth shot because their bodies are less able to produce that protection that the rest of us have.
Right now, about 65% of the U.S. population is fully vaccinated. 28% have gotten a booster, but the pace of vaccinations is the slowest it's ever been. Health officials say there needs to be a continued focus on raising those numbers.
We need to get the third of Americans who haven't even gotten their first two shots, we need to get them vaccinated. And then of those who received their first two shots, older folks, people who are age 50 plus, should be going to get a booster today.
A fall second booster timeline coincides with when flu shots are typically given, which could be convenient for more people. It also makes sense because respiratory viruses like the coronavirus and influenza tend to peak in the winter months.
Now, experts are still determining whether adults in the U.S. would need a fourth COVID shot in the months to come. Here in Georgia, we still lag months behind other states when it comes to vaccine administration. So far, we've administered more than 14.3 million COVID shots since they first became widely available. This is the state administering this. Only about half of the Peach State is considered fully vaccinated, and only 39% of people have received a booster out of this number. Nearly 40% of people who live here still have not received a single COVID vaccination yet.